Namaste and welcome to yet another interesting Facebook Live session. Today, we're diving into a very critical topic brain tumors. And we're very privileged to have with us Dr. Balamurugan, Neurosurgeon, Apollo Hospitals, Chennai. With his wealth of knowledge and decades of expertise, we are in for a very interesting session where all your questions and your clarifications will be handled with respect to brain tumors. Welcome, Doctor.
Thank you.
What is brain tumor, doctor? Let's begin with that. And how does it develop?
So we are all aware that brain is an organ which controls the entire body. It is comprising of the brain as well as the spinal cord, and the brain is encased in a tissue layer called the dura, and above that is the bone. The entire brain and the dura is contained in the skull cavity. So tumors can arise either from the bone or from the covering over the brain called the dura, or within the substance of the brain. The incidence is not too high because the brain tissue itself, the neural tissue itself, does not divide, but the supporting tissue called glial tissues tend to divide and can cause tumors. So roughly the incidence is about 1 in 1,000. And the reasons for developing these tumors, there are not very significantly analyzed yet. We still do not have any great data to suggest that this is the reason for developing a brain tumor.
And how common are brain tumors? As in, what are the common symptoms that one comes across that we should be aware of?
So the commonest symptom which most people tend to have is headache, and headache which is maximum in the morning when they wake up, associated with vomiting, is a sign which is going to be very critical in recognizing, especially in children as well as in adults as well as in elderly people. The second most common symptom would be any changes in behavior. The third most common symptoms would be weakness of the hands, legs, or the face, which is very similar to how we recognize a stroke. So if the patient has a facial deviation, a weakness of the hand grip, or difficulty in walking or imbalance, then we will have to look out for and get a scan done and meet the doctor.
Is brain tumor a condition that can be passed down from generations, doctor? Does family history have any impact on the risk factors?
So it is not very common. Most of the brain tumors are not passed down through the family, but there are a few called neurofibromatosis. There are a few types of it which can be passed down by genetic involvement. And most of these children tend to have some form of sign when they are born, where there will be skin markers, where you can have some kind of hemangiomas, or you can have large birthmarks or tufts of hair which can be seen. So these children will have to be watched closely and possibly screened for look out for tumors.
Are all brain tumors of one type, doctor? Are there various types like what you mentioned right now, hemangioma? Are there many more types of brain tumors?
Yes, there are multiple different types of brain tumors. There are benign tumors which can arise from the skull bone, from the covering over the brain, or within the brain. These are usually like meningiomas, osteomas, or gliomas. Then there are the malignant varieties, which are like glioblastomas, medulloblastomas, or gliosarcomas, which are very malignant forms of brain tumors. And we can have very, very slow growing, indolent, small tumors arising from the nerves which come out of the brain or the spinal cord called neurofibromas, which can be very slow growing also. And rarely we can have tumors spreading from elsewhere in the body to the brain. Metastatic tumors like from the lung or from the intestines can also happen.
Doctor, with the rise of digital devices today, how does screen time affect the risk of brain tumors, if at all?
There is no real causal effect of screen time on development of brain tumors. Although, just like any other part of body which is normally overused, we may tend to have effects of it. There is no real causal effect as of now.
Mental health, doctor, which is again a growing concern with this, which is linked to the digital devices today. Mental health is a growing concern today. Is it a contribution or to the development or progression of brain tumors?
Not really. There is no real causal effect again of any mental health issues causing brain tumors. Although the reverse is possible. That is, a brain tumor can be recognized if a patient has sudden change in their behavioral patterns, like a person who is normally very soft and soft spoken suddenly becomes very aggressive or has behavioral changes or inappropriate behaviors, then we may have to look out for brain tumors in these patients.
Can you explain, doctor, in simple terms for layman understanding on how radiation exposure, whether through medical procedures or environmental sources, or again exposure to constant digital devices, does it impact our brain?
Not really, because the brain, as I told you, is comprised of tissue which does not divide very quickly, and only the supportive tissues divide very slowly. So the chances of any radiation causing brain tumors is very low. About the devices which can cause brain tumors, there is no real causal effect which has been established. Sporadic reports of excessive usage of mobile phones causing some tumors within the year have been reported, but not really been proven as of now.
Doctor, you had mentioned of the symptoms that one can notice. What is the next step? What should one do when they find out all these symptoms are with for their loved ones?
So the most important, as I told you, is going to be headache with vomiting in the early morning as they wake up. And the other is the signs which we normally associate with a stroke, whether it's going to be facial deviation, hand weakness, or leg weakness, or imbalance. As soon as either the patient or the relatives notice this, I think the first thing they need to do is to consult their general physician, who's going to put them on to a neurophysician or ask for certain tests, which may include either a CT scan or an MRI or an angiogram, based on what the problem is and how the next step is going to be taken. The best would be to meet the local family physician, who will put you on to the best possible neurophysician or the neurosurgeon.
And how is brain tumor removed, doctor? How is it treated?
So, brain tumors, based on where it is located and what is the size of the tumor and how the patient is at the time of coming to the doctor, will determine how the tumor is removed. Quite often, because of the availability of CT scans and MRIs, we are able to detect tumors quite early. So, we are able to give the best possible for these patients. The best method as of today, the gold standard, would be microsurgical removal of the tumor, whereby a small opening is made in the skull with the help of various navigation procedures and microscope. We can go in and remove these tumors with minimal risk to the patient. Of late, over the past 5 to 6 years, we are also doing surgery on patients when they are awake during the procedure with minimal anesthesia. That is, the patient does not perceive pain, and he will be interacting with the surgeon and the anesthetist as the tumor is being removed. So this is called as awake craniotomy, and this is a big boon for us, because when we are operating on areas which are very functional to the patient, like speech area or the area which controls the hand and the legs, it is going to be very important that we do the procedure as an awake procedure, so that we are able to assess the patient as we are doing the surgery and give the best possible outcomes.
That's amazing, doctor. How does awake craniotomy impact recovery, doctor?
So the patient is awake through the procedure without perceiving any pain, and he is able to interact with us. So let us say the patient who's a right-handed person, has a left-sided tumor in the region of the temporal region or in the frontal region, which controls our speech, our understanding. So when we are operating on the patient, we ask them questions which can be like to identify color, or to name a picture which they are seeing, or to memorize their relatives' names or children's names or their parents' names. And we keep asking these questions as we are operating, so that if the patient has any difficulty, then we stop the surgery, then we reassess again, and then go ahead and remove this tumor. So that is how this whole procedure is done.
And are there non-surgical treatment options available for the treatment of brain tumor today?
Yes, non-surgical treatment for brain tumors are available for chosen few. Like, if the tumor is less than 2 centimeters, we have what is called as a cyber knife treatment. Now, cyber knife treatment is a very focused, high quality radiation to the tumor. This causes the tumor to stop growing and gradually regress in size. These are for selected patients, especially those like in the extremes of age, where surgery can cause problems for them, or the patient is not anesthetically fit to undergo the surgery. This procedure can be used.
Doctor, what are the latest non-invasive treatments for brain tumor, and how are they compared to the traditional surgeries? Like you mentioned about awake craniotomy today. Are there any non-invasive treatments available today?
I think the most important thing is, let the surgeon decide what is best for the patient, and the most important thing is never be afraid of brain surgery anymore. It is not like what it was 40 years back or 50 years back. It is a very safe surgery. Just as there has been advancements in cardiac surgeries and in orthopedic surgeries or in kidney surgeries or in transplants, brain surgeries have undergone a tremendous improvement. So the risk of undergoing surgery in good institution, in good hands, can be as low as less than 0.1%. So the chances that the patient may lose life is almost minimal. So instead of searching for a non-indicated, non-invasive method of treatment, it would be better to have a good surgery done in a good place and have better results.
Doctor, you mentioned about kids also being diagnosed of brain tumors. Is brain tumor a condition that can happen regardless of age? What is the difference between the treatment for a young child vis-a-vis treatment of an adult, doctor?
Absolutely. Brain tumors can happen at any age group. The smallest child we have treated is a newborn with a tumor arising from the cerebellum, and the oldest patient we have treated is about 98 years of age, where the patient had a tumor which started from his lung and went to the brain. So it can happen in any age group. And just as children are very sensitive and very fragile, the very elderly also are very sensitive and fragile. So surgery is a challenge when we are doing on newborns or very young children. But now the technology, the anesthesia, the post-operative care has improved so much that excellent results can be given for either the very young or the very old.
Speaking of challenging cases, can you tell us one of your most recent challenging cases that you had
I think
encountered?
I think the most challenging recently which we had was in upper cervical. It was in the pons and the medulla, and in the upper cervical region we had a patient with a tumor called as a hemangioblastoma. These are very vascular tumors and but benign. They are problematic because of the location where they are, and excising that and giving an excellent outcome to this patient was such a challenge, but it was so satisfying.
What are the potential side effects, doctor? Are there any side effects, first of all, in terms of brain tumor treatments? And how are they managed to improve the quality of life of our patients?
So the advancements, whether it is in surgery or in anesthesia or in the post-operative care, has really changed the outcomes in brain tumor surgery, where the problems were encountered in about 20 to 25% of patients about 30 years back. Today, the chances of having a complication is less than 1%. The best way to avoid is to have the best possible investigations done. Have all the details with us before the surgery is being planned, and planning the surgery in the best place with all available technology, whether it is navigation, microscope, CUSA, or fluorescent enhanced tumor resection surgery. The more the utilization of technology and with trained personnel, I think the best outcomes are given.
And how important is early diagnosis in the treatment of brain tumor?
Just as any other disease, I think early diagnosis makes the biggest difference. And earlier they detected, the better is the outcome. The smaller the tumor, better is the outcome. The better the resection, the better is the outcome. The better the radiotherapy, better is the outcome. So in every aspect, the early detection helps in better outcomes. And just as we have early detection, preventive health checkups, if we suspect, there is absolutely no harm in undergoing an MRI of the brain and assuring ourselves that there is absolutely nothing to be worried about, because MRI doesn't have even a radiation. So it is absolutely safe even for children.
Speaking of course of treatment, how do you determine, as an expert, how do you determine the best course of treatment for an individual with brain tumor, considering the location of the tumor or the type or the age or the gender? How do you decide, doctor?
So the various factors which go into determining what would be the best treatment option for a particular patient with brain tumor starts with the time of diagnosis, what is the presenting condition of the patient, and what is the size, site, and the eloquence of the area in which the brain tumor is located. Eloquence meaning what is the functionality of that portion of the brain, whether does it control important functions or not. And the performance scale, we have something called as a Karnofsky performance scale, whereby we assess what is the condition of the patient, what is the ability of him to perform certain basic functions, whether he is able to take executive decisions, whether he is able to take care of himself, whether his behavioral patterns are normal. So all this are various factors which go into determining what would be the ideal treatment option for a patient.
We'll take some questions from our viewers, doctor. I've been experiencing constant headaches and changes in my vision. Could this be a sign of brain tumor, or are there any specific symptoms that I should be looking out for?
So any headache which is, see, all of us are going to be having headaches, but any headache which is not usual, something which you have not experienced before, or which is a regular headache which happens early in the morning and is associated with nausea and vomiting, sometimes just vomiting without nausea, or vomiting without loss of appetite, then it is something which we need to be concerned about. Any vision changes, whether we are able to see the entire field which we are seeing, or whether there is any restriction in the field of vision, or there are black spots in the visual field, then it is a cause for concern. Definitely, when we have regular headaches with vision changes, the patient will need to be examined by a neurophysician and a scan to be done.
Hello, doctor. I'm 56 years old and diagnosed with choroid plexus tumor. What are the challenges or considerations in the diagnosis and treatment of this tumor that I should be aware of?
So the first important thing is going to be how the diagnosis has been made as a choroid plexus tumor. What were the symptoms? What is the age? Whether the patient is having any diabetes, hypertension, cardiac problems, and what kind of tests have been done, whether it is a CT or an MRI. The ideal thing would be to have a neurosurgeon to have a look at the entire picture and then decide what is the ideal course of treatment, whether it is going to be microsurgical resection or direct radiation, will all depend on how the patient is going to be. I suggest meeting a neurosurgeon at an early date.
I'm 27 years old and my family has had a history of suffering from various types of brain tumor. What changes should I make to my lifestyle and diet to minimize my possibilities of suffering in the future?
The most important thing is that you should not worry that you're going to get a brain tumor. Just because someone in the family has a brain tumor doesn't mean that you're going to be developing one. As I told in the beginning, the chances that it is being genetically transmitted in a family is very low unless it's neurofibromatosis. And I don't think you should be worried. Dietary pattern, I think there are a lot of evidence to show that a healthy dietary pattern, on time, proper food, and proper sleep cycle will help in having a good outcome. But first thing is, do not worry that you're going to be getting a brain tumor.
Speaking of dietary habits, I have a very interesting question to ask you, doctor. What are the superfoods for the brain? Are there any in the first place?
There are no superfoods for the brain, but foods which can cause problems for the brain, better avoided would be a good idea. So any of the trans fats, high fried food, fast food, or high salt intake or high oil content is all going to cause damage to the brain. I think if we avoid them and have more of fresh vegetables and fresh fruits and plenty of liquids, I think that will be good. There is no real superfood for the brain, but I think any food which is fresh and homemade will be good for the brain.
Doctor, what are some of the misconceptions about brain tumors that you have come across when your patients come to your OPD?
I think the first thing is the fear that a brain surgery, they're going to die. I think the most important thing that they need to realize is, in best centers, in good hands, the risk of death due to brain tumor surgery is less than 0.1%. So the first thing is to remove the fear of surgery. Just as today a heart procedure is a routine, just as today any orthopedic procedure is a routine, just as today any renal transplant is a routine, brain surgery is a routine surgery in good centers where there is high volumes. So first thing is to remove fear. The second thing is that fear of being incapacitated, not being able to get back to work, that also should be taken off from the mind. As long as the surgery goes off well and the patient has come out of the anesthesia well, the chances that the patient is going to be incapacitated is minuscule. So do not fear of surgery.
What would be your message to our viewers today, doctor?
First thing is, look out for symptoms. If there are symptoms, meet with the family physician first. He will put you onto the neurophysician or the neurosurgeon, and you will be having to undergo certain small tests. Do not worry about these tests. Get it done. And if at all anything is found, the best possible course would be take opinion from a neurosurgeon of repute to give you the best possible outcomes.
Thank you very much, doctor. That was a very informative session on all we needed to know about brain tumors and how do we effectively manage an early diagnosis as well. For appointments with Dr. Balamurugan, neurosurgeon, Apollo Hospitals, Chennai, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, doctor.
Thank
Thank you,
you.
viewers.